Hi. Today, trapezitis is one of the common major issue for which the clients are rushing into the physiotherapy clinic. Trapezitis is commonly occurring for everyone today's day-to-day life because of the lifestyle changes. This trapezitis is more common. In trapezitis, the patient will often complain about the pain over this area, the shoulder, the above the shoulder area, the area just nearby the neck, the nape of the neck, this region, this entire region. Okay? Actually, this region is covered by trapezius muscle, the upper part of the trapezius muscle, and this region is covered by the middle part of the trapezius muscle, and this region is covered by the lower part of the trapezius muscle. In this, especially the upper part and middle part, the uppermost middle part of the trapezius is going for it is giving some vulnerable site for any kind of lifestyle injuries. What I'm speaking about lifestyle injuries is I'm speaking about the repetitive injuries, because people always use the hand for doing anything, for by means of riding a vehicle or cooking or doing some activities with the help of hands. They always tend to utilize the trapezius nowadays, especially nowadays when you're riding the bike with a lot of traffic. Whatever may be the activities we do in our upper hands, the two muscles which are working hard, one is upper trapezius. More than that, the subscapularis muscle, which is underneath the scapula, that is in between the scapula and the thoracic region, that is going to work a lot, especially when you are doing any kind of activities just above 30 degree in any plane. That muscle is going to work, and when those muscles are getting tired, ultimately the trapezius is going for overwork. Due to that overwork, that muscle will go for fibrosis. Continuous fibrosis of this muscle will happen. That will cause inflammation. That is called repetitive strain. That produces inflammation. Repeated inflammation will cause fibrosis of the particular muscle, and in due days that muscle will become spasm, tightness, and suppose sometimes when we palpate the patient, it becomes very hard to palpate. Yes, he is seeing some pain over this area, and I palpate, so I can feel some spasm over this area. Okay. For this, I am going to give you some certain tips how to avoid this. First thing, we have to modify the lifestyle. That means we reduce riding the bike. One. Second thing, when you are going for using the bags, especially college bags and all, try to wear it on both the sides, not on a single side. You try to wear the bag as much as possible to the center of the back, not too down. So if you get it in the center of the back, the trapezius will go for lesser inflammation. Of course, it will go for inflammation, but anyway, lesser inflammation. Try to ride a bike. Please check whether the bike is appropriate for you. Suppose, for example, if the bike you are riding is not up to your height, your height is not enough to reach the ground when you are riding a bike, definitely you will get more trapezitis. And when you are riding the bike in cities and all, if the road is not good enough, if the road is completely filled with pits and muds, then definitely you are going to have trapezitis. So try to avoid those kind of situations. One. Then, whenever you are going to do any work in the kitchen or any works, better you go for small exercises every day in the morning, at least some 10 minutes of exercises you do. For example, slight stretching and slight mobility exercises. That's what I'm going to teach you now. I'm going to teach you one stretching exercise, one contraction exercise, that means strengthening exercise, and one mobility exercise. Totally 3 exercises. Okay, can you see that now? Yes. Get on. One is, I'm going to ask the patient to go for elevation of the hand completely, and then ask the patient to get it down. Okay, both the hands. Take this up to reach the above head area and come down. Again, can do it continuously for 10 times. This is just a simple mobility exercise. Your entire shoulder region will get activated. And stretching exercise. Keep your hand this side. Okay. Now you try to grab it here like this, hold it here, right? You pull it downward, little, gently, very little, gently, okay? And try to get your head opposite side. This will produce nice stretch for the trapezius. Suppose if the stretch is not enough for you, if you are feeling the stretch is not enough for you, then leave it, keep it little bit relaxed, and then keep your hand at the side of the head near the ear and try to pull your head to the straight opposite side. This will stretch the trapezius. For strengthening exercise, you just try to shrug your shoulder like this. Yes, try to shrug the shoulder like this. Hold it for 10 seconds. No, straight your head and hold it for 10 seconds. Keep it up to 10 seconds and then don't put it suddenly. Leave it relaxedly, you put it down. Again, you keep it for 10 seconds. Again, hold it for 10 seconds and then relax it. So continuously you do it up to 5 times. Okay, relax for 30 seconds or 40 seconds and you have to repeat it for 5 times. Okay, these are the 3 exercises which will help you for strengthening as well as produce free mobility of your shoulder. It will increase the fluidity of the joint also. Good. These tips will surely help you to alleviate the trapezitis and reduce the trapezitis and alleviate the shoulder pain. Thank you.